Welcome to my presentation on atypical development dyspraxia physical development presented by Annika Johnson. Today on my agenda, introduction, dyspraxia physical development, incident of dyspraxia within Montserrat, diagnostic techniques used for dyspraxia globally and within Montserrat, early intervention that can be used by teachers to assist preschoolers with dyspraxia, 3 long-term effects of early interventions for children diagnosed with dyspraxia, conclusion and recommendations, and also references. Introduction. To define atypical development, one must understand the basic knowledge of typical or normal child development. However, according to Child Growth and Development Unit 6, atypical development refers to when a child exhibits patterns of behavior that falls outside the normal range, emerging in a way or at a pace that is different from his or her peers. Later on in this presentation, I will be sharing diagnostic treatments such as occupational therapy, which is being used in Montserrat, and others which are used globally such as perceptual motor training and early intervention for dyspraxia, such as incorporating physical activities into the classroom daily routine in order for children to practice movements. Dyspraxia physical development. Dyspraxia (DCD), which is sometimes called clumsy child syndrome, is a disorder that affects motor skill development, and children with dyspraxia have trouble planning and completing fine motor skills. Children with dyspraxia may be chronically or accident prone. Dyspraxia has learning difficulties which can cause children to struggle at school. Dyspraxia is veered more towards movement and planning difficulties. Some of the things that children with dyspraxia have difficulties with and also early signs: their balance, handwriting, getting dressed, and using utensils, which are fine motor skills. They would bump into things without being aware because they have issues negotiating space, issues riding a bike, and when they are playing, they would have difficulties trying to catch or even bounce a ball. Also, they do not know when or where something begins and ends. They have issues negotiating their strength, so oftentimes they would grab something too tight or too loose. Dyspraxia is often categorized on specific symptoms. These may be summarized as follows. Constructional. This type of dyspraxia affects the ability to understand spatial relationships. Movement of object from one place to another becomes difficult. Ideomotor. This involves difficulty in completing a single-step motor task. This could be activities such as combing hair or slipping on shoes. Ideation. This involves difficulty in performing multiple step tasks like brushing teeth, putting clothes on in order, tying shoelaces, or buckling up. Oromotor. This affects speech more than other motor function, difficulties according to the muscle movement needed to pronounce words and symbols. Incidence of dyspraxia within Montserrat. According to Ms. Fenton, who works in the Ministry of Education and specializes in special education in Montserrat, stated that there hasn't been any recent reports of dyspraxia over the last 5 years. However, incidents that were reported before shows that only a small number of children are affected within this disease. with this disease, which is 1 or 2 children out of a class of 30. Diagnostic techniques used for dyspraxia globally and in Montserrat. Within Montserrat, occupational therapist is being used, which assists with coordination and balance and many other motor skills. In order for the occupational therapist to determine which kind of movements are giving the child trouble, she starts by doing an evaluation. Ms. Fenton stated that the reports that were made are children struggling with writing, walking, and catching a ball. The occupational therapists were able to break each of these motor skills into smaller motor tasks to make it easier for the children to practice different movements. As the child practiced at home and in the classroom, the children were able to become more skilled at carrying out those movements. Montserrat follows the same protocol used globally, but uses a different technique for dyspraxia. Globally used techniques used are perceptual motor training, speech therapy, and hypnotherapy. Perceptual motor training is a set of exercises that some therapists use. Speech therapy can help if dyspraxia affects your child's ability to pronounce words correctly. Hypnotherapy is when a therapist uses the natural movement of a horse to help the rider work on physical skills like balance and coordination. Early interventions that can be used by teachers to assist preschoolers with dyspraxia. Incorporating physical activities into the classroom daily routine, such as handwork before a handwriting session and a 5-minute wake up and shake activity for children at the start of the day and after lunch. Provide a variety of writing tools and encourage children to choose the one that they find most comfortable with, such as pencil with a grip. Adjusting a child's seating to facilitate a better working posture, providing furniture that enables a child to sit with their bottom back, feet flat and elbows resting comfortable on the table without hunched shoulders, will allow them to use their hands more effectively or find motor tasks such as writing and manipulating tools and equipment. Good seating will also help their attention and concentration. 3 long-term effects of early intervention for children diagnosed with dyspraxia. Individual skill. These interventions focus on the individual, for example, developing gross and fine motor coordination, using both hands together and developing hand strength. Occupational therapists also think ahead, helping children to develop the foundation skills that will need to manage more complex activities as they get older. This is particularly important for children with coordination difficulties who need extra opportunities to practice and master skills compared to their peers. Activities. This intervention focuses on the activities such as pencil grip and control, using cutlery and getting dressed. Difficulties might be addressed by recommending alternative equipment or finding another way of achieving the task. Environment. This intervention is for the environment. Environmental interventions include organizing equipment so that it is easier for a child to find or reach, recommending more suitable seating, or providing training so that the adults who live and work with the child respond to their needs with a greater understanding. Conclusion and recommendations. To conclude this presentation, I would highly recommend that as soon as a child shows signs of dyspraxia, the parents should seek medical attention because most of the disorders can actually improve. However, disorder cannot be cured, and there are no medications for this disorder. Even though a child suffers with some form of disorder, which is not just limited to dyspraxia, every child can learn and they shouldn't be taken for granted or neglected. Early intervention approach aim is to enable children to master and carry out a meaningful functional activities that make up their daily routines at home, at school, and at play now in the future. References